So, okay, I think the topic is why people think COVID-19 is fake, and is that justified? Like, is it justified? Like, why, the reasons why they think it's fake, is that justification for not wearing masks and not listening to, watching all these other people?
So I think there's probably, I think there are people who don't necessarily think it's fake, but they also don't want to wear the masks. And don't think
I think it's a multi-tiered issue.
It's not just people think it's fake and won't wear masks.
Well, why do people think it's fake? Why do they think this COVID-19 thing is just a hoax?
Well, the numbers are so high, and I talk to people globally, and none of them like really know anybody who knows anybody who has had a very serious illness from it. Like, even if people have had it, it's more they quarantine and then they're fine. Now, we have our uncle who is dying from it, but he was very sickly anyway.
Well, plus he's in a hospice, and he could have been like given it. Like, remember so you know how those like 5 Democratic governors allowed coronavirus patients to be placed into hospices?
Yeah. So they required them to be.
Wait, is that proven? Where did you find that?
It was on Instagram, but you could type it in on Google. Here, I mean, I can type it in on Google and it'll show.
I'm curious, like, is this something somebody made?
Well, okay, so Biz, they put it nicer though. They said that hospices cannot. They said hospices cannot refuse to take people who have coronavirus. They kind of said it in a different way. But in what happened inevitably was that they were forced to take coronavirus patients, even though they couldn't protect them.
The governors required them to.
They said they could not turn them down.
If that's actually true, I don't see how you could not make the leap to that's actually criminal, because what you're doing then is
absolutely. I hope that's not what happened to our uncle too, because like, how would he have gotten it? He was in a hospice.
You got it from a mechanic.
Until after. All right. Well, regardless.
I also want to just really quick state the fact that I have read that, and this was from a news article, and they said that in their research they found that the government said that for every coronavirus patient, the government would pay, I think it's $13,000, and then for every respirator used for coronavirus, it's $39,000. It's $1,000. I could be saying the wrong numbers. Either way, whether the number is, even if it's only $1,000, there is financial motivation to say that people, just to do the medical coding. Sometimes people will get a bill for something that was completely unlike anything that any treatment they had received, just because of the medical coding was wrong. But
what do you mean
by for coronavirus?
Like,
they get money.
Money that they can then allocate anywhere. Do they receive money in addition to other aid from the government? Like, I'm just wondering, like, if all money is not created equal, what does that mean that hospitals will receive money for coronavirus patients?
I don't really know what that means. I mean, people aren't being charged to be treated for coronavirus, so the government pays it. I don't know what you mean.
Well, it's more incentive to say that you have COVID, right?
Yeah, there has been I read an article that said many people they tested positive, and then they're in the hospital being treated for it, and being told, like, you have symptoms X, Y, and Z, and then they're retested for whatever reason, and it's negative. They're a false positive. They've also read accounts of people saying that they sent in tests of papayas and cantaloupes and random things, and they've gotten positive tests back.
Here, Busy, I actually have proof. This is from, so there's 333 labs report 100% of people testing positive for coronavirus. So what it's saying, I could possibly share the screen actually, but.
Yeah, you can share screens.
Okay, it is InfoWars, but they're not lying, so I don't want random people to be like, you're doing InfoWars, even though, I mean, it should be valid.
I'm just saying, like, the only reason I'm asking, there's a lot of data out there, and data can be skewed and manipulated very, very easily. So,
yeah, right. Do you guys see my screen?
It said you started screen sharing, but I don't see anything yet.
Okay.
Because you're right, data can be skewed, and that's why it's irresponsible of the news reporters to to not double check that or to verify that the sources aren't biased or something. You know, they shouldn't be reporting numbers if there is a bias.
Well, Ada, like I was telling you guys the one morning with Trump pulling out of the CDC, I read an article that was basically pro-Trump talking about it, and then one that was anti-Trump talking about it, and it was crazy how different the article's bias was, you know, the basis was.
Curious where you found a pro-Trump article.
I don't remember what stage.
Hey,
I didn't see any. I saw a ton like saying that it was irresponsible for him to do it. I don't really know why. I don't know enough about the organizational structure of like the CDC and the Department of Health to know.
Okay, wait, so hold on, let's look at this article.
So 333 Florida COVID testing labs reported 100% positive tests, which basically meant that 100% of the people who went in to get tested were declared COVID-19 positive.
Yeah, that seems highly
it's ridiculous. It's just not true.
Yes.
And I think the answer. So then this one said that 90.99% positive cases, which is statistically just because statistically that's ridiculous.
Yeah.
Sure. But let's see.
Yeah, statistically that would be impossible.
Yeah, and so I read this other article. I'm gonna have to find it here. I'll stop sharing.
I'm looking up the hospital funding that the government gives under the CARES Act, it's called. And apparently the government will give a 20% weighting factor to what they're already funding hospitals if it's coronavirus related issue. And apparently it only applies to people enrolled in Medicare or enrolled in Medicare, apparently.
Well, then who's paying for the free coronavirus testing? Because I was tested for free.
I don't know about the testing. I'm just talking about hospitals getting more money from the government for having coronavirus.
And also, so then look at I'm curious about the population of people in the country that are on Medicare.
It says in New York City, it's only about 16%.
Yeah, but what demographics of people?
Oh, I don't know.
Because I'm curious if there's a correlation between that and then the people that are testing positive for it, you know? Like just to look at even more about.
Oh, yeah. That's a great question, yeah. But why would Florida hospitals say 100% are positive?
So,
like, why does that matter? How would that help them get more money?
Jimmy, there was a follow-up of this, and it states that a further investigation revealed that the true positivity rate is only 9.4%, not 98 or 100%. So in reality, it was significantly less. And well, partly based on what Ada said, if you find a positive, I mean, we can look into motive in a bit, but I think it's very clear that they've been lying this entire time. For instance, you hear these rumors about how people who died from motorcycle accidents or something died from COVID. So what they're doing is people who've tested positive for COVID, no matter how they die, say they die from a heart attack or say they die from like an airplane accident or something, they declare that a COVID-19 positive death. And what
they just say if they tested positive for COVID-19, which is pretty much unregulated, I guess. I mean, I don't know.
Mm-hmm.
If they tested positive, then they could mark them down as a COVID-19 death, regardless of whether they were killed by COVID-19.
Exactly. And based on what we've already just seen is that Florida's making everybody like test positive for, COVID-19. Like 100% of people go in, even though it's not even true. They'll say, and they've actually retracted a lot of that because they got caught. So they're inflating the numbers significantly to show that they have a lot higher, what's the word? Like travel rate, I guess, or like spread rate, and then a lot higher death rate too. Or they're trying to keep the death number as high as possible.
And I want
to say,
who is they?
These hospitals are. I mean, these Florida hospitals for sure are. I don't know.
I would argue the CDC. The hospitals. Well, I think, yeah, I guess the hospitals, I don't know. I don't even know. The CDC has been the one releasing all of the numbers up until that article that said that which specific hospitals tested positive,
It's
right?
like Orlando Health, which is a hospital in Orlando, Florida. They reported a positivity rate of 98%. But when they looked into it, further investigation, because it was just so ridiculous, and it was actually only 9.4%. That was just one case. There's a lot of Florida. There's 333 Florida hospitals that stated that they had about 100% a positivity rating, which is ridiculous because months ago it wasn't even near that high when you got to.
Oh, I would look into that. I would look more into what funding they're getting.
Well,
You know,
I mean,
Jimmy, since that article you read.
Yeah, I don't know what they're getting out of that.
You must be getting something.
Unless like news outlets start, like CNN's paying them to like fraudulently report so they can keep reporting on virus. I don't know. I'm just
you
making
need to
stuff
have
up.
a motive though. Like Ada, you know well enough in the law, motive is almost necessary to prove.
Yeah. Yeah, without a motive, you can't really prove it.
And yes, there's entirely possibly motives that we are unaware of, you know, as peasants in this country. There's many things that our government is doing without our knowledge, without our okay, and actually illegally, you know, every single day.
Izzy, I think part of the motive is they basically are trying to inflate a second wave. This is by Ron Paul, and he says cases, like a few months ago when they'd say there's like a case in the news, it once meant individuals who had like sufficient symptoms. And now that they want this second wave, I don't know if you noticed in like the last month, they keep talking about a second wave of coronavirus. They're basically reporting any positive test result as a COVID case. And we already basically have shown that these test results are completely inflated. So yeah, you're right. The question is why? And I think it's partly they want a second wave. To me, it seems like they want to keep shutting everything down.
So that would be what I would tend to lean towards. Like you keep a level of fear instilled in everyone, and it keeps the economy backed off. And also, so like for example, in Chicago, after the 4th of July weekend, Lori Lightfoot as mayor has repealed now you can't eat indoors anymore at restaurants, bars and restaurants, where you were able to before.
Yeah.
So I would argue that clearly this is like cause and effect. Mm-hmm. Keeping these numbers inflated is in effect keeping the shutdown happening. You know,
well, the question is why are they doing that? And we could go on to masks. I know you wanted to talk about whether or not we should.
I do want to talk about masks, but masks it's almost like, you know, you have a thermometer for how a society is doing. And it's just like such an ancillary thing, the whole mask situation. I think you can take it in a lot of different ways, but I'd like to go to the foundational piece of this entire issue first, which is
sure.
Is this a real thing? Is this actually happening? You know, has this happened in our world? Is it something that is being utilized by our government now against us in some ways? You know, and then we can move on.
Here's my questions about this, because obviously, like, even our parents, they say they've never seen anything like this happen in their lifetime, where you have everything goes on lockdown because of some disease coming around. So either if the virus is really as bad as they say, and it justifies the lockdown that's going on, either like the virus is, I don't know how it got that powerful, because it hasn't happened in anyone's memory that like such a virus is this bad to justify a lockdown. Like, it almost makes me think that either medicine is allowed for the virus to become like very like they have those super bacteria that are like immune to antibiotics and all of that, or it's like man-made, because if you're gonna say that it's this bad, like there has to be a reason that the virus could be this bad, because like diseases like this don't seem to be normal, right?
Like, and Jimmy, there's been evidence for at least a decade of my knowledge where technology exists to have something like an illness be spread through mosquitoes that's completely manufactured and engineered by human beings, and to attack very particular ways. You know, so I would say like that's an entirely plausible possibility.
Or it's not that bad, as bad as they're saying.
I would tend to argue that, because if it was as bad as they're saying, I think we would have a little bit more. Although I have read a lot of people and heard a lot of people where it has hit closer, you know. So I think for us, maybe we're just not living the life that other people are, and we're not seeing it as much. I don't know.
Well, apparently, John has said I guess he's looked into it more. Like the death rates are low enough to say that it's really not that bad.
Like 99.95 or 6% of people who get it aren't even gonna. I mean, they're not even gonna die or anything that
and
bad.
what I read was over 70% of deaths, and that could be anyone in a car accident who is marked as a COVID death. They're in nursing homes. That's over 70%.
So here's the article here. Scalise said that adding 40% of the nursing home deaths in the United States occurred in the 5 states who Republican lawmakers, who the governors allowed the nursing homes.
Here's what I'm just confused about. Okay, I've been hearing. I kind of just shut off the news. I don't know. I can't stand hearing all this misinformation. I don't know who's telling the truth, so I just shut it off. Right? I had someone telling me yesterday that, well, this causes lifelong neurological damage. COVID does.
Well, I heard that there's studying, but there's no.
Is that real? Like, here's the thing. Why? I feel like, you know, if you're immunocompromised, stay home. Don't go out. Why are you shutting down the entire economy for something that most people won't be that affected by? People are aware of it by now. They won't be going to see their elderly families. I mean, how many mom and pop shops got shut down? Their entire life's work.
Yeah, but
what is the motive though? Is it just some authoritarian?
I don't know.
They didn't know the effects though at first. You know, like shutting down the economy is a preventative measure. I would argue an international pandemic is necessary until you get a grasp on how many people this does affect, in what ways it affects them. You know, where is this going to go?
I agree with that. Yeah. So from that, then let's look at where we were getting our information from that caused us to shut down. Italy, China, right? I mean, that's why we shut down, because
places that had huge issues with it, you know, like
yeah.
I don't think they ever should have shut things down. I think people can decide on their own whether or not they should like go to work. But I do think that what's weird, if that is true, which is I think how most people would agree with what you're saying, then like these governors haven't issued orders for businesses to make people wear masks until a couple weeks ago. Like I feel like the orders are coming out like recently for things to be more shut down.
I don't know. In Chicago, we had to. Well, yeah, actually, right. It was probably about a month ago where the masks became mandatory. Like you flat out couldn't go in a place without having a mask on. Maybe
it was like that when I was there.
Yeah. Okay. Maybe a little bit longer, but you're right. It wasn't from the very beginning of all of it. Right.
So why is it all of a sudden they're escalating things? They're acting like it's gotten worse, and it hasn't. All that's happened is they've got more test kits, so they're testing about 10 times more. But they're just finding 10 times more positive rates.
Known false positives. Reporting known false positives.
And they're definitely reporting their inflated numbers.
I think you're sensationalizing this a little bit. I do think that you want to prevent an illness from being widespread through your population for many reasons. And doing preventative measures like closing down shops, requiring masks, things like that is not that big of a deal. I get what you're saying with timing. It doesn't quite add up, but I don't know. For me, it's on the cusp. Like when they did require masks, there were still numbers being released by the CDC and other outlets, at least that I saw, that suggested that this was more far-reaching than we first realized, that this was more easily spread than we first realized. However,
I think that's the issue.
You can't trust the CDC for this anymore, though.
That's the issue. Like, I understand the governor shutting things down. I understand that at a local level because obviously you're being told there's a pandemic. So we've all been told, but I still go to the grocery store and I still see the same people and I still talk to the same people, and nobody knows anybody who's really been affected by this. Or if they tested positive, it's something like they quarantine and then they're fine. If there's been nothing so negative that would warrant an entire shutdown. And I understand the people who did order the shutdowns, they didn't know. But who's behind this, giving these numbers, causing them to say, let's shut everything down?
They're trying to inflate it. They're trying to, it seems like they're trying to cause a shutdown.
Well, also, like, if you look at a place like New Zealand where they have had 0 new cases, they literally have eradicated, yeah. And what they did was they flat out shut down everything for a period of time, everything, and that was it. And then it's gone, you know, like then you open it back up.
I didn't know that. They had no cases.
Hold on. I have this fat baby sitting on me. John, are you able to just Google that really quick and see with New Zealand? I read this about 2 weeks ago, I feel like. That
makes me wonder then, like, just cynically, the hospitals that are reporting positives and that are, like Johnny, you said they reported 100% positive, and it turns out only, 9% were positive?
333. That's not a small number. That sounds like a concerted effort by people to lie. Right? I mean, they looked into a few of the hospitals and they said it's actually more like 9%.
Yeah, that's a concerted effort to lie. So I don't even know, like, saying compared to here, their efforts were much more, like, they were much more, like, useful, I guess, shutting everything down. How do we know it was any better if we can't trust the numbers?
I think,
I want to get to the bottom line.
Yeah, the bottom line of this conversation, at least the direction we're going, is that we can't trust the numbers. I think that's very clear.
New Zealand, the government reported that today there's been no new cases of COVID-19, and there's only 27 active cases remaining in New Zealand.
Right. So,
and also, I just want to make sure I messed up that 20% extra money that the government gives to hospitals with COVID-19 patients. It applies to Medicare patients and those without health insurance as well.
Jimmy, I have a friend whose wife is on the board at the Cleveland Clinic, and I will tell you right now that they're getting more than that. I'm not going to go into it on a podcast because I don't know what he would want me to talk about, but there definitely are false reports going on because of for monetary reasons, and I don't think it's just for.
Well, Jimmy and Ada, do the hospitals get money because if they find positive patients, like, you know how like there'll be grants given to people to show proof of global warming? So is it like they're giving money to these hospitals to prove or to basically only for positive cases, and that could be incentive why they're lying so much? Do you know if that's true? Like you know how you give money to some hospitals, they give free flu shots. They get money if they give more flu shots, so they want more people to go. So is it kind of like that?
That's right. Yeah, like there's an incentive to publicize or to do an advertisement to get flu shots, because those are everywhere in the last like several years.
Yeah. And so what I'm saying is there like an incentive for the hospitals to give positive ratings, so they get like some money per positive rating, or is it just to get tested? I'm asking if you know.
I don't know. I haven't. It seems to say that governments already give funding to hospitals, and it seems to say that funding will increase by 20% for anything related to COVID-19. Is basically
so I think
for patients, related to COVID-19.
The problem with all of this is so in-depth. It's like such an interweaving web of deception, of mistrust. Like no one feels like they can trust the government for the most part. I would argue that there's a very small percentage of people who actually do trust the government and by the government, I mean the United States government, and feel safe with news outlets. So you have that as a layer to all of this. And then
well the news outlets, whatever, they've been proven time and time again. I can go into it, but they just lie all the time, that you can't really blame people for. It's like a boy who cried wolf. You can't blame them for not listening.
Well, exactly. And it's just exhaustion from all of these new issues and all these new things being raised that you have to care about and that you have to worry about. And so by the time there's a pandemic, if it actually is something you should be worried about, it's right. It's like the boy who cried wolf. You're just...
You want to know my theory? This is not an actual theory. This is just something that I've gathered. You guys
well, we should try to keep it as factual as possible. I know we're kind of speaking off the cuff.
Well, I just want to point out that all of a sudden this is happening and you're not hearing about Hong Kong anymore. You're not hearing about Epstein really anyway. All you hear about is this.
Well, Gilon.
Anytime there's something that takes over the news for so long.
I agree with you, but this doesn't seem like just like a random school shooting where it's
this is global. So I mean, I would argue like, look,
so is that.
The very fact that this is affecting everyone globally, to me, lends me to believe that this is really happening and this is true. Now, whether our response as the United States is in alignment with what we're actually seeing or facing as the United States is plausible, or if that's true, like.
But even with the numbers, though,
I'm not sure.
Even with the numbers they're giving them, it's like, okay, this is obviously a real thing. It obviously originated somewhere, probably Wuhan, China.
Like Trump says.
From China.
Do you guys know what is happening in China? What are their numbers like now? And Italy? Because
China's just like tapered off, which is bull. They're probably just like lying about it.
I saw evidence though that China lied about their numbers to begin with. So whatever, I wouldn't believe.
But Italy, like I remember right before the quarantine started, it was getting really bad in Italy, and
yeah. Well, Italy though, I think that they, from the last thing I read, they were actually on the up. Like not as many new cases. They were doing really good with.
Here, there's a stat.
Very large older population too.
Dude, there's a stat that the number of people this flu, COVID-19, has killed about a third of what the flu has killed last year since it started.
John, I've heard stats that definitely are the exact opposite of what you're saying.
Really? Well, is you talking? I'd have to look at specifically what you're saying. I'll have to find it. Give me a sec.
Yeah, and like I'm sorry I don't have anything in front of me. But look, I think that the fact that everyone has heard different things, you hear things at work, you hear things from friends, relatives, like all over the place, you're hearing all different kinds of information and different numbers, different stats, and there's nowhere that I trust enough to fact check against. Not one news outlet I trust enough to be like, you can't even, because if the hospitals are spitting out flawed information, there is no study.
Yeah, the hospital's been caught spitting out flawed information. Well, okay, here's my whole thing with this that I think is like the most important thing, even if it was a pandemic, like an actual pandemic, because this is clearly not that bad. I think giving government the authority to shut down and get involved with private people's businesses is far worse than just allowing this pandemic to go through the population. And by the way,
but John, you couldn't say that at first because no one knew how bad this really was. Now they're figuring it out a little bit more that this might be more far-reaching but less deadly than first hypothesized. I agree with you.
It definitely. Since we've known how lax this was since March. We've known in March that it was not nearly as bad as they thought. So I figured shut this down for like maybe a week. I wouldn't even shut anything down. I just don't think it's right. But
I actually don't agree with you. In March, that was when the numbers were increasing worldwide, and that was when it actually started to become really scary.
Yeah, but they've already known about the spread rate and the death rate. They've known since March that if you're like over 60, you have a higher chance of dying, and if you're young, you're fine.
But John, the worry at that point in time was people infecting, like people were carriers that might not have any symptoms. I mean, this is still the worry. And especially it might affect a certain subsect of the population, but they really didn't know how deadly and how far-reaching the effects were at that period of time. I mean, anything with healthcare, it takes time to study it and to realize, effects. Like,
I still don't think you should give the government the power to do this, because they can keep this up.
But I do want to know,
years.
I'm genuinely curious. How do they know that there are people who are asymptomatic who have it, who are curious? How did they find that out?
Because they were able to test virally. So the same way you would be able to
Well,
test.
they had no tests at the beginning. They had none. I remember this because they were saying kids are carriers, and I was like, how? They have no tests. Then they
didn't have tests that were able to be distributed to the public. But I thought you were able to draw blood and figure out whether somebody was carrying this virus.
I don't think you needed a specific test to test if somebody had it, was my understanding. And like my thought was just like, okay, like yeah, kids are asymptomatic. How do you really know though? Like if you're seeing it, I mean, how could you possibly find that out?
Use like a sample size.
It doesn't have symptoms when you.
Yeah, I think that was more something that was just said that was far, like from what they'd seen in the sample size that they tested, it seemed that kids were more carrier. I don't think there was ever a definitive fact like there.
That was the scariest part about it when it first came out, was that like, that the boogeyman essentially. It was, you were scared. There were people who had it who didn't even know they had it. You could have it. I mean, that was the worst part about it. And like the symptoms are literally every symptom any person has ever displayed ever for any sickness. So it was just like.
Well, okay, so if we get back to, yeah, and I agree with you, it was kind of a witch hunt, but the very nature of a medical malady affecting globally is something that everyone's kind of scared of, like this is something that literally could kill human beings. That's why zombies as a thing exists. That's why, not real zombies, but that's why it's something that human beings are intrinsically fearful of. Because it is possible to wipe out a species with something. So,
do you want to talk about masks mandate?
Well, I want to get back to, let's get back to the government. Okay, so when we discussed what government is and what it stands for, I do think that there is a responsibility of an entity to say, if there is something so contagious, some kind of restrictions against.
So you're going to force people who, by the way, a lot of people have lost their businesses. The economy is apparently tanked, and it's because they're forced to shut down. They screwed over a lot of people.
Well, John, this is why, and I do understand, and I don't. There's not a really good answer to what should have been done. What was done was the right thing.
There's a simple answer.
Because look, John, if you don't have an enforcement in some ways of closing, you will have people forced to go to work, and this is highlighted that, who will drop their kids off at daycare because they have no other choice but to do that. And then their kids might spread it through daycare, who will have to go to work and have no other choice but to go.
Okay, you're getting to the face mask thing.
No. Why won't they have, how do they have a choice now? Because the government's giving them money? Why couldn't the government just give the option to give money?
So Jimmy, there were governments though. Wait, there were governments though that did. This is actually what a government should have done, in my opinion. The government exists, we pay into it in a lot of different ways, and they should have had a trove of money set aside for something of this nature, which our government did. And they should have spent it on their citizens, forcing everybody to go home, giving everyone an allotment of money instead of bailing out the fucking corporations that didn't need it. They should have paid everyone to stay home for X amount of time until this is eradicated. We know the reaching effects, 2 weeks incubation period. And that is what some governments do. And I feel like that's well within the rights of a government to enforce something like that. Okay, now we can move on to what our government
with the Constitution.
Not America's government, but go on.
Constitution aside, if you look at this rationally, I don't give a fuck about the Constitution, actually.
Okay. We can look at this rationally, but
the Constitution has been bastardized through centuries of right now.
Then Biz, what are you going to do about Walmart? How are you going to have Walmart open? Who's going to work?
Yeah.
How is everyone going to get money?
Walmart was open.
In my hypothetical.
In your hypothesis, Wait, so
Hypothetical-
just Walmart would
My
have closed?
hypothetical situation, there would have been an alert that this is going to happen. We are going to close down everything for this period of time, and you would have essential businesses such as healthcare and police force still active, and that would be it. And that's
Well,
what
groceries
happens in
and
other
toilet
countries.
paper.
You stock up, and also some governments sent care packages to people. Like they
Oh,
literally.
as a government, you're saying.
You're
Yeah.
getting way too much faith in the government. They're retarded.
But John, our government's so piss poor that right.
There's too many. I
It
think
would
there's
never
too many
work.
ways
You
to
have people like
track that.
AOC in there. I mean, it's just never gonna. Look, if I thought that they were smart enough to do it, then maybe. I just don't trust their integrity for one. But
John, what would you? All right, out of curiosity, what would you have proposed the government do? Our government. Well, okay, so
Okay.
two
At-
ways. A perfect solution, and then what our specific government should have done.
well, my answer is probably the same for both. I think people should. Our government, because at the time people thought it was going to be really bad, they should have alerted everybody, which they basically did. They said there's a dangerous virus. Here's what we think you should do: wear masks, practice social distancing, wash your hands. That's what we were recommending to people. Okay, so if you personally are afraid of getting sick and you do those things, then you're fine, you're good. And if you're not worried about it, then you're not going to be able to get anybody else sick because they're going to be washing their hands, they're going to be having a face mask, and practicing social distancing. So why didn't they just do that?
People who would not have wanted to be in public, like they would have wanted to quarantine themselves and stay home, are forced to go into work because they literally cannot afford to miss even a day.
Okay, then what would be the difference between that and what's happening now, which is that people are not able to go to work because they're not essential and they're not getting money anyway. They got one paycheck from the government and they're screwed. They're not getting anything else. There's so much unemployment. Unemployment's skyrocketed, by the way, but there's still a lot of people who still don't have unemployment. So I don't see how it would be any worse than what's going on now.
But also unemployment skyrocketed, and then I know several people who are like, well, I'm not going to look for a job right now because they got their unemployment plus $600.
Yeah,
So-
it was more than they're making.
Yeah, so they weren't looking. And now I think that they redid it. The 600 ran out, and I think they redid it for 400 maybe. Which is still like a lot.
No, Biz, I mean, do you agree?
Why was it, John, I don't know, because it's not black and white. I really feel like this is a really tough issue. I think that part of me does think a government's position is to protect its constituents. So if there's going to be exploitation in some ways, like people being forced to go into work and not wanting to because they don't want to get sick, I think that there should be an option for them to not. I hate anything that the government does in terms of bailouts, because what ends up happening is that they bail out huge corporations, like the trickle down thought process, and that never actually works. And I also cannot stand the fact that the reliefs were tied to taxes. That's bullshit. They should have just been every single citizen gets a flat amount, like call it a day. Every
You
single
know what's kind of funny, guys? Lars hasn't filed taxes in years, so he didn't get anything. I laughed a little bit though. But
That's pretty funny. But busy. Also, but the thing is, like, I think I would rather trust a bunch of corporations or whatever, whoever you work for, to do the right thing to their employees than the government who, or then the government who forces hospices to take COVID-19 patients. I mean, for real, I would rather have that, because at least corporations have more incentive.
I don't trust our government at all, nor do I trust corporations. They are literally intrinsically tied, and
I agree with you. I do agree with you there. But I don't see how the government is trusting the government in this case would be any better than just trusting the individual.
I think, okay, so actually let's take your scenario where government does not mandate anything. They deliver guidelines on how to protect yourself.
They just recommend yourself, yeah.
And recommend. Okay, so the economy would have kept open. My work would never have shut down unless mandated. Like never, people would have so I think that I don't know. I'm a little lucky and I'm privileged in some ways in that if I miss some days of work, I'm not starving. So for me, it's a lot easier to say, well, I could have just walked away. If I were in the position though that I used to be, say I was 18 years old and I had rent money due and I was, like how I literally had to survive paycheck to paycheck, I would have had to go into work and I would have just had to been really safe about it.
Well, why couldn't you just wear a face mask and
I don't know what would have happened, like say I had a lung issue, an autoimmune disorder, and I went in and I did get coronavirus and I was so sick and potentially dying from it, I probably would feel differently than I do now. I don't know.
Okay, so I'll concede that. So worst case scenario, a lot of people are forced to go into work and a lot of them get sick and die. Do you think that's worse than what happened?
Or worst case scenario, it was much worse than originally thought and people are dying in droves. That's worst case scenario. It was far more contagious.
If people were dying in droves, the corporations would have absolutely started closing down. It would have been like techno. Or could people were actually dying? I mean, it just looks terrible for you. Government would have done the same thing.
Okay, fair.
I just think I don't get this idea. I never understood this notion that if like the government doesn't force you to do it, it's not going to happen. I do agree that corporations' first thing is obviously to make money.
Yeah, but so corporations driven by money, I think regardless of what the government says, a corporation's going to do things based on the will of the people. So like what they're, like if their customer base is pushing for something, they're going to do it. If they're...
And I'm not even saying that's the best scenario because you're right. Corporations are greedy. They lobby like crazy. They'll do whatever it takes. Like there was this one stat I saw.
The government are literally one and the same in so many different ways.
Right.
You can't really
actually... Well, there's this one stat that said the best thing you can do for your company, that's like the number one, it was like the top 3 things you can do for a business. And like in the top 3 choices you can do, one of them was like lobbying. Lobby the government, your return is like 100-fold.
I have a friend who did it as a job and his dad owned multiple businesses. This is like my friend he was adopted from Honduras into a very wealthy family. And he said lobbying, if you own a business, you pretty much have to lobby or else to compete. You have to.
Yeah. It's effed up. But yeah, I agree with you, Wade. I think lobbying should be completely out there. I don't think
it's all bullshit. And John, oh, sorry, what were you gonna say?
Oh, I was just gonna say, I saw something on Reddit and it was like, I think that politicians should wear, like NASCAR racers wear on their car, like all the logos of all their sponsors. Politicians should be required to wear all of their sponsors on their suits, like at all times. Yeah. Not a bad idea.
Dude, I think politicians are bullshit. Career politicians are bullshit. Like I've said before, the only reason you would even have people that are career politicians is because they have the experience of how to deal with global politics and how to deal with other countries. But you could learn that in other ways. Like there's no need for it. Our government's fucked. The response to coronavirus has been pretty fucked. I think that the more I think about it, the more I do tend to agree with John. However, John, what you're losing in your scenario is the individual. Like you're looking at this from a really wide perspective. If this gets closer to home for you, say somebody fairly close to you got coronavirus and passed away, you probably would feel differently about it.
They were forced to go to work or something? Like if they got
they had been forced to work.
Yeah. Wait, sorry, what'd you say? Both of you were talking.
I see what you're saying, John. If like, let's say somebody in our family who's very sick was forced to go into work, then that would be totally different than if he got sick, because he kept going to the store and wasn't taking precautions.
Yeah,
I think that's different.
Yeah, Biz, I do agree with you. I ultimately though, I just lean towards the idea that it's just so much worse giving a group of people the authority to close everything down. And I guess in this case, it was easy because clearly COVID-19 is not as bad as people are saying. Like they're fudging these numbers. They're trying to make it sound as bad as possible. It's obviously, I don't know anybody who even has it. I guess everyone's has it.
What's scary to me is that behavioral psychology has been used to control large populations of people throughout time. and I feel like people are definitely more aware of this as we continue on. You know, like the introduction of Facebook as a social structure to gather information, like with the advent of being able to know people's thoughts in their homes through something like Alexa, or you know, like there's data being collected on people that has been so far-reaching that we are now able to really pinpoint how to control the masses. And there's been brainwashing on such large scales that what's scary to me is something like masks, having to wear them. It's not going to end. I do think I do think that it's fine to require masks at this point in time if there is an actual preventative measure to not get people sick. It's something like Pascal's wager. You know, we're better off betting on wearing them than not if we're going to actually prevent illness. I'm fine with wearing a mask if it's not going to get Grandma Laura Arthur sick, whatever. My worry is that you take something like, look at what the airports have been doing since 9/11. People get used to things very, very fast, and they forget how things were before. You know?
I'm concerned about something like, okay, I mean, there have been talks everywhere about this vaccine coming with a chip or something like that.
Yeah.
You know, there's so much of, you're not allowed, you know, no shoes, no shirt, no mask, no service. That's like the norm now. That can very easily become a mask. The vaccine.
They can apply it to anything.
Why?
It's terrifying.
What's the motivation behind forcing people to wear masks?
What's the motivation? The government requires government employees to get flu vaccines. What's the motivation behind that? Like, I don't even want to get into flu vaccines today, but there really is no motivation behind that, but they are required to. They're required to. Like, our cousin, his sons, they're both required to get flu vaccines. Why? There's no reason for it.
Who do they work for?
He works for the city.
Well, not specifically.
He's a garbage man. But yeah, he's a garbage man. But
let's not name anybody else here who works for the government.
But I mean, the whole family has
crazy.
to get them mandated, and I mean, we all know the flu vaccine is not effective. I mean, it's ridiculous, and you're mandated to. So let's look at what's the purported purpose for requiring this vaccine. Well, they just give us these fake numbers and have enough people to buy it.
A vaccine's much different to me though than a mask. I think that like a mask, I don't know what the motivation would be to force something like that unless it's a legit preventative measure for getting over.
I like research the mask.
Like, did you?
Yeah,
okay.
I said it doesn't even work for viruses.
Yes, that's what I read. And then
it depends on the material. No, it does depend on the material of the mask. But the masks that were like recommended, like in the UK, for instance, obviously it's not the United States, but in the UK, the masks that they were forcing everybody to wear literally said that it does not protect against COVID.
Well, then,
I think that the cloth I wear.
Yeah, like a cotton cloth you don't want to wear anything like that because it absorbs moisture and viruses travel through the moisture.
Because I kind of
what are we missing here then? Why would that be required and it be?
I don't know. I will say it does cause a divide between people. You go out, you don't talk to people at all. You know, like
that's true. There does seem to be something nefarious because it makes no sense.
It does.
It really doesn't.
It doesn't make sense.
To me, something like a vaccine, that's invasive. We were just talking about Botox, and you have, you know, like not wanting to inject anything into your body that to me is literal rape. I mean, like you know, like you should never be forced to get a vaccine if you don't want to get it. That being said, I think that, you know, taking in the research, like I'm going to continue to vaccinate Kaya with things that I think she should be vaccinated against, like, of course. However, I think a vaccine is a much different thing than having to wear a mask. Like, I don't know.
Yeah, that's just my thought process behind, like, you know, there's a purpose for wanting everybody to wear the mask. What is the purpose? Because everything I've read says that it's not effective.
It makes me
getting sick. And so what I'm thinking, and moreover, realistically, guys, if there's a virus that affects a very small percentage of the population, even if it is large in numbers, it could affect you at home. Is it really smart? Is it worth it to effectively neutralize the whole population's immune system to save people who wouldn't be strong enough to get through this, right? Like, I mean, as a species, that's just kind of biology, I think. I don't know.
I think that's a moot argument. I think that would take a long time.
Sure. So why require these masks? You know, if you want to take care of yourself.
Even if the masks were 100% effective, I still think it's wrong to mandate them. Just like mandating this. Like, I know you agree that Kaya should take the vaccines, but what if the government tried to force you to do it? They said you have to have your baby.
Well, I don't want to get into vaccines today.
I feel uncomfortable about anything invasively mandated.
Right. And just like you said the other day about how seatbelts, you're against anybody wearing seatbelts, like forcing to wear seatbelts, because that's so inclusive. So if you have a mask on, let's say masks are 100% effective against the virus, why would you mandate that? You could, if you're worried about it, you put on the mask and go places, and you're good. You're not going to get sick because you have a mask. So why would you mandate that?
I do agree with you. But I do think it's fair for stores to say we require you to have a mask before entering.
Okay, if a private company like a store wanted you to wear a mask, and that's fine. But I'm talking about a government mandate.
That's like a preventive measure for their employees. I fully understand that.
That's fine. I get that too. I would probably do the same thing.
But something I do get a little worried about with the masks, it's like a fucking uniform. It's one step closer to requiring you.
I'm with you on that.
Population to be whatever, and we'll get into it when we discuss the taxation. But we have entered into a master-slave relationship with our government.
It feels like a social condition.
Absolutely. Well,
the question's
we'll get into that when we discuss student loans.
Yeah,
doesn't make sense.
In many ways.
What doesn't make sense to me, I'm not sure like the health science about it, but I know at least with gloves, because I worked in chemistry labs, you dispose of them after one use because you can get chemical on them, and once you take them off, it's easy to get on you again once you throw them out. It'd probably be the same thing with masks, right? If you get something, it should be disposable. You should throw them out after every single use. I don't know a single person that's using disposable masks. Everyone's reusing them every time.
I see a lot of people reusing them. They sell them like cutesy prints and stuff. Like they'll market them towards kids. These are pink with unicorns. You know, these are like blue.
Yeah,
right.
Exactly.
But you're supposed to like wash them. I don't know.
You know, that is a good topic.
You're supposed to though. That's how it would work. Make sense to me. If anything any virus got on the mask, then you'd have to wash it off or throw it out.
I think we can all agree that it doesn't make sense because you have to wear masks, but there are no mandates on what the mask has to be. So I see people sometimes with like
it's so stupid.
Anything wrapped around their face. It's like it really doesn't seem right. You know, like if you're gonna say this is a preventative thing, but not account for what it's preventing and in what way and how. You know, like
it's like Peter was telling me in the military, he just said he has higher ups who are just so dumb, but they're whatever, you have to do what they say. And it's like the same thing here. It's like,
well, I mean, then John, that brings up an interesting point. Maybe this is behavioral psychology, a brainwashing path to accept further things. You know, like that would be my only.
Makes sense to me.
I think that's a major concern. I think people would be like negligent to turn a blind eye to that possibility because.
No, but let me ask, who's the one who ordered these 333 Florida hospitals to basically fudge their numbers and say 100% positive, which is statistically.
I don't think that was an order. I think that was a natural byproduct of providing revenue or whatever it is.
Yeah, it could have been.
It could have been. Yeah, that's true. I actually.
But who is? And I mean, all right. Well, then who's ordering the media to? I mean, there have been so many reports of and pictures of behind the scenes like news cameras where they're all socially distanced. Everybody on the news wearing their masks, and then as soon as the camera shuts off, they take them off. It's not even an issue. They clearly don't even think it's an issue themselves.
They're just bullies.
Who's behind this?
We as human beings, look, you have to look at, we as a species, everything we do right now is within a social construct that we made. The clothes we wear, the way we talk, the way we, but there's certain base things for the ways we interact with each other. And a lot of it is herd mentality. So for example, the wedding I was at last weekend, in the church, everyone had masks. Pews were closed. Like, it was like every other one. But the second we got to the reception, no one had their masks on. It was
That's
like
a
nothing even like existed.
But
I do think it's like people follow other people's.
and that's my point. Who's behind the news
I don't think that this.
demonstrating this?
I think it's insidious. Like, do you remember that video John showed us where people tie agendas to other things? You know, so you have a big event that affects a lot of people. You tie an agenda in there, and I don't think anyone trying to think.
What is that
John,
noise? Is
that's
that
like
me?
your mic or speaker. It's John's. It's like the. Or it's done that a few times.
Sounds
Really?
like somebody's trying to talk to us from your computer.
Literal messaging.
That's weird.
Yeah.
Yeah.
John, when it happens, your voice gets really loud when you talk. It's like this.
Is it okay now? Can you guys hear me?
Yeah, but you are louder than everybody else.
That's weird.
What I was gonna say is though, I don't think it's ever like any dictation like A to B. I think it's more little things that you know are pushed around like little things that everybody doesn't know how to take, and it gets to an end result that somebody might want. You know.
I
so-
know what you mean. Like the hospitals fudging the numbers.
Right.
That was
right,
from
right.
the government off, saying we'll pay more money. But I do feel like there is.
Chess game. It's not checkers, you know, like it's not like.
Well,
direct-
okay then let's get to the source. They said this was caused from a bat. Does anybody believe this?
I mean, I believe that it's possible.
I didn't know I believe that in Wuhan, China, that it was caused by a bat. Like the capital of.
Have you seen the marketplaces and how dirty? Like, I think it's entirely possible.
Yeah,
that
I do get that.
Could be caused by something like that.
I do get that. I've only seen videos of them though. I mean, Jimmy,
There was
you've
like a
been there.
Nobel Prize winner that was saying that there's no way it came from a bat. It had to be man-made. He was looking at the virus.
Really? Okay.
me
I
see
haven't-
the
That's
Friends
what that
article.
woman said. That video that I sent you, that got taken down off of the internet. I can't find it since.
that's
She studied like immune disorders and like vaccines her whole life, and it was just, I don't know.
Yeah,
I wish
John,
I
let
wish
me-
you'd
let
watched the
me-
video.
Share my screen.
I know Johnny watched
for
it because I talked with him about it, but she
You're
was
approved?
saying also that for
you gotta
a
manage.
virus to mutate to the point where it's at, where ours is, it would have taken like I can't remember how many years, but she
Jim,
said
I don't know how.
it took
Okay.
10. So there's just no way that without human intervention that it would have gotten to this point. I don't know. I'm just taking their word.
Jimmy, I
I
think
don't know
you have
anything
to.
about it.
No. You disabled it.
That is, which side do you trust? And why do you decide to trust one over another? It's really difficult.
Well, if one side has a financial interest in it being the way they say it is, then I don't. It's not that I don't trust it. I automatically take off a few points on that one. and I look at the other side.
It's fair to question it.
Yeah.
Fair. That's fair.
Jimmy, I don't know how to do it. I'm looking.
Okay.
Do you know how?
I can't. It has to be from your, because you're the host. I don't know what your screen looks like, but
I can make you the host, I think.
This guy, he's the Nobel Prize winner for his work on HIV.
Oh,
All right, Jim, you're the
I read
host.
something about this.
Okay. Yeah, can you guys see this?
Not
So,
quite. Hold on. I just see it started screen sharing.
oh really?
Do you guys see anything?
Not yet. It said it. Yeah, here
Oh,
we go.
there it goes.
Okay. So I don't know how delayed my scrolling is, but yeah, Luc Montagnier. You know French. I don't know how you pronounce this, but he won the Nobel Prize in 2008 for his work on HIV, and he says he thinks the virus came out of the laboratory in Wuhan, which has been specializing in these types of coronaviruses since the beginning of the 2000s. So
Jimmy, I actually read that a long time ago, right when this first came out, and have not heard anything since about the Wuhan specialization in studying things like of this nature. But coronavirus existed as a viral illness prior to this bat scenario, right?
Coronavirus is just the flu. It's literally just a flu. COVID-19 is just a different strain of the flu that happens to be slightly more deadly and about as infectious, I guess.
Don't you remember I sent you that study from 2017 where they
Yeah.
gave soldiers flu shots? Yeah, I mean,
Yes.
it's in the same class. It's been around forever. I mean, it's not like something new or novel.
So I think it's clear that they are using this like a motive is just to gain power. That it's
And what gets me is saying that it comes from a bat because Chinese people are so dirty. Sounds to me like an attack on China, which I don't know. Whatever. To me it sounds.
Don't you remember, Ida?
I have heard they are filthy, but I don't believe that it was not created in a lab. I
Here's
just
another
don't. I mean,
theory
you
for
have
why they might be doing it.
lab, like Wuhan. I mean, I've heard about Wuhan for years. It's been rumored on like 4chan and stuff to be a place where they study viruses. Like what do they call it? Where it's a warfare, like biological warfare. I mean, I've known about it forever. When it comes out of Wuhan and you say it's from a bat in a dirty marketplace, like, okay, maybe, but more likely that it's not, and that it was intentional. And what was with the Asian doctor, or the doctor who was arrested coming from Canada or smuggling something out of Canada? Do you remember? You know what I'm talking about?
I know what you're talking about. I don't know.
I know what you're talking about.
What was that about?
I don't know.
It was a doctor at a university who was caught trying to smuggle something into China. And he worked at, I don't remember which university, it was either Canada or the US, and he was arrested, and like, I haven't heard anything since. And they think, I mean, it couldn't have been the virus. I don't know if it was like, I don't know what that was, but there was just so many weird conflicting stories around the time. Like, I just feel like there's like a lot of parts to the puzzle that I just don't know where to put them.
There are a lot of parts to the puzzle. I think my worry more is just that, like, we're seeing small ripples start from this. We're not seeing the large ripples of whoever, of a real agenda to this yet.
Here's one theory on what the agenda might be. Tucker Carlson made this point. He was saying it's an election year, and in an election year, everything has to do with the election, at least in terms of politics and the media. So he was saying one reason that these news outlets just keep hyping and hyping the virus is to make it so Trump is less likely to get elected. And
I wouldn't be surprised.
It keeps conservatives isolated. Meanwhile, people who tend to be more liberal are going outside protesting racial issues and stuff like that. Which they're like actually organizing.
Jimmy, actually, that makes a lot of sense what you just said about the election. Because I think it is a multifaceted situation, like what Busy was saying. There's definitely, I think it is a lot about just getting force over people, like just more power, like what people are willing to give up. But this election thing definitely makes sense because,
especially with it tying to Black Lives Matter as a movement, tying to, like John, like that video where all of these things really are lumped into each other. And it's back in psychology. It does leave implicit traces in people's minds of each of these issues, and I absolutely think that it's possible it's tied to an election. However, who are our candidates? They're old fucking geriatric bags.
How did Biden get in? Come on.
Dirty Biden.
Did Biden ever on the Lolita Express to Epstein's Island?
No, I don't know. I don't know about him and Epstein.
I know Bill Clinton and Hillary Clinton.
I know that he's senile enough that anyone who wants to control him probably can. It's probably not that hard. I mean, he is going senile, right? Like, I'm not the only one who's said this.
Ada, I told you that video
yes.
is now removed off of the fucking internet. With him just being crazy, talking to the group, it was blue collar workers for Jim and John's benefit, who it was just a rally, and they were questioning him, and he started going off, he was getting really angry, but not really making sense. He is very crazy now, and only time we tried to look for it again, and we found one video of someone who's there on a camera phone who posted.
And that's like that's another thing, you know, who's taking these videos down, but that's for another day.
Well, I think that there's definitely, like, if you look at not Google AdWords, but like SEO type marketing, there's automated firms that can flag words on the internet and immediately, like, I mean, there's a lot of automated firms.
I just think that, dude, so the Kung Flu, which is like the greatest name of all time for this thing.
It's actually really funny.
But dude, I actually think, now that Jimmy says that, I think it is like probably just, it's mainly hyped up because of this election. Because you notice how they don't care if you're in Black Lives Matter, which is basically a terrorist organization whose leaders are Marxists, and they openly admit that they want white people to basically die. These are the leaders. It's not, you don't even have to look too deep. These people are crazy Marxists, but they're okay to go and protest and do whatever, riot and loot. I guess the media just covers that up basically, and they don't care at all about the COVID protests. But when Trump supporters go and have a rally, they get all up in arms. It just, the double standard's insane, and it probably is just from this election. That's probably a big.
Well, I would say from, like, I would call myself pretty impartial for most of this, but there were news. So after all the Black Lives Matter rally, I heard nothing regarding coronavirus cases, not one thing in association with the rallies and anybody getting coronavirus. I heard a ton after the Trump rally about how everyone got coronavirus.
It's ridiculous.
Personally, I think, like, look, if there is a fear of getting sick, there shouldn't be any rallies. But once again, I don't disagree that it should be people's choice if they want to go in and do that. A lot of this is so media driven, though. Like, the reaction of people is so media driven, you know?
Absolutely. Yeah, the media has too much control.
And with social media censoring posts that try to go against the narrative of COVID-19, no one hears anything else how to act.
Dude, it's not even social media anymore. It's Google. You type in, like I typed in freaking something on Google just now about COVID-19 hoax, and like nothing about hoaxes come up at all. It's just like,
Google has been complicit in it for a while. It's crazy. That is where I get my news, is from the internet, because I don't trust any mainstream media. Like, I've been flat out lied to enough times, or like there have been things where I'm like, this is obviously newsworthy, I'm waiting for them to report on it, and they just don't. It's all clearly run by the same, whoever the fuck is running it. Like, remember that when I said that video of all the news outlets saying the same thing? Or like when WikiLeaks came out. When WikiLeaks came out and they're like, you're not allowed to check this. This is only for the news to look into. What?
Oh yeah, huge. That guy is he was. That wasn't just one.
That was all the news outlets were saying that. They were saying,
they're like, only we're allowed to have it.
Right. Yeah, but it's WikiLeaks. Like, anybody can go.
It goes back so far in our history, and it's not just the United States, but like, look at JFK. So when he was elected, he was the last line of okaying an attack on the American public, and I don't remember exactly what the attack was going to be, but people would have definitely died, and he was the last line. This is actual fact at this period of time. It didn't used to be. Previously, this was a conspiracy theory. Now it's been confirmed. But the fact that our government would perpetrate crimes against its own people, premeditated murder, that would have actually, been hammered out to be. Like, this is no big surprise that we can't trust our government, or that something else is going on that we don't know about, or that a lot of these things are tied together. Like, they would be shocking to me if there wasn't something else going on with something like this.
Yeah, we should have another discussion about that, like with actual, like really look up these facts, because there's obviously something going on. It just seems so totalitarian. They're like trying to to me, it seems like they're just trying to have everyone give up their freedoms. They can basically just tell us what they want us to do.
And I mean,
Yeah.
Joey, like I would argue, like at this period of time, I'm fine with wearing a mask until this is more, like until we know more about.
Yeah.
I'm not going to argue against that. If this continues on, though, there will be a period of time where I think that this is an overreach, that this is some kind of.
It's been an overreach. It's been an overreach since March, man. I'm telling you. Like, they've known it's the same stuff since March. I agree with you at first. Maybe the first few weeks you really don't know, but like nothing changed. Nothing has changed. It's just more reporting. There's more escalated reporting on it. That's basically BS.
You guys saw that article that I screenshot for you.
Biz, we can't really hear you.
Oh, sorry, you guys. I might need to go because this baby is going nuts. I think I need to
Oh.
Okay, we can end this.
No, well, I just want to say really quick. You guys saw, I screenshot that thing and sent it to you. The news article saying, or whatever, it was on Reddit. It was like, research shows that people who are more likely to not wear masks are like, I have more dark features, like sociopathic tendencies. I mean, that's insane. It's insane to come to that conclusion.
I'm like, that's
say
so
that about anybody. Where did you pull that data?
It was like your booty or something.
Oh yeah,
your booty or something ridiculous.
Oh yeah. That was the best part.
It's stuff like that, and then there are so many more people than you would think who are like, who really would be like, oh yeah, that person not wearing it, they must, be a sociopath or something. Like there are a lot of people who really do read this stuff and buy into it.
Yeah.
It's just crazy.
Well, that's the thing though with psychology. Like you hear something, and it really is. It leaves a mental effect that will change your feeling about a particular thing, even if it's untrue. That's psychology. I mean, that's like such a huge push into herd control and like mass control. It's really scary. Like, I mean, I guess at the end of the day, what are you gonna do about it? I don't know what to do about it.
I don't know either. The people who are protesting, like I do feel that it is an individual store's choice to say you have to wear a mask. And so I'm not going to be an asshole and go in there and not wear a mask.
Yeah.
But they weren't, no store was saying that until the governor told them they had to. A few weeks ago, I'd go to Walmart, I didn't have to wear one.
They have to.
Yeah,
I was in Aldi yesterday and I didn't have to wear one.
Really?
But there have been other stores that require it. Yeah.
Dude, the governor definitely made Cuyahoga do it like a week ago.
Cuyahoga, yeah. Remember we went to Texas State Brazil? Like, dude, I want my salad bar.
Yeah.
So what's one paid for? The salad bar. Like, what the hell?
And he said you just have to wear one walking in, not even in the actual place. Makes no sense.
That's another thing. There's no purported purpose for wearing it. Where do you walk in, and then when you walk, what? I can also walk at my table.
Like
I said before, even if you do wear one, it should be disposable. You should have to get rid of it and get a new one every time. But no, the CDC is not recommending that, are they?
Who even knows? I saw that Trump ordered that all hospital COVID testing results, whatever, go directly to the Department of Health.
Because the CDC was lying their test results. They were completely lying.
Yeah, I've seen.
Remember that bombshell
that say that it was because they didn't have the resources to hold the data. But I think it was because the numbers are made up. There are people, I saw pictures of protests in Italy where people were mad. They're like, this has all been a hoax, like a gigantic hoax. But I don't understand why, if it was just for the election, why would it be in global? Because
from what I've looked at is the CDC is controlled by China, and so they were doing serious damage control for China. And they were saying that they said it can't be spread through the air or through touching, which is a complete lie because any flu can. So they lied about that, and they said that it was not nearly as bad as like a flu. And so hold on, I'm gonna pull up these tweets if I can find them. Gosh, I'm never going to Google.
So are they related to Google?
Wait,
no, Google just.
I have to go. I gotta feed her, but I'll talk to you all later.
All right, you see you, Busy. Biz, or Ada, Google Google just shadows everything. Everything against the status quo. So I don't know.
I know that. My question was we were actually watching the video that you had made with Ben, And there were ads on there talking about how it was, and I never watch YouTube. I hate YouTube.
Hello?
Sorry, someone moved the door. But there were ads on YouTube like, China, it's China's fault that we're in this position. Like China did this to us. I feel that there has been propaganda that has been very anti-China. Well, I can't tie the pieces together. I don't understand where it's all fitting in together. Like, because I do know that the CDC is heavily run by China or heavily influenced by China. So is Reddit. So is a lot of other,
Zoom. What we're on right now.
What we're on
Zoom
right now.
prevented
TikTok.
meetings of people in Hong Kong from because like protesters in Hong Kong wanted to organize and Zoom
That's
didn't let them.
ridiculous. I want to know more about that.
I think they changed their policy or something, but there was an instance when they did not let them. Ada, this is off topic, so I'm not even gonna mention it. But never mind.
Man, dude, I'm even on DuckDuckGo and I can't find these stupid tweets that the CDC had a few weeks ago.
The
What did they
CDC
say?
tweeted you can't just go on their Twitter.
I think they deleted them. COVID tweets. I don't know. It's just annoying.
What would you know they're about?
Everything, like I type in COVID hoax and the first like 30, 20 articles that come up are COVID hoax rebuttal or COVID hoax. It's a fact check. It's like fact
John,
check.
what were the tweets about?
It just said that the CDC, one of them was like, in February they said that, COVID-19 cannot be spread through like the regular flu can. It can't be spread through contact, which is a complete lie. And they also, I think they're the ones who said it came from a bat. It's like,
Yeah.
can't trust that.
They also said masks don't help, I believe. I just don't get it. I mean, I don't think that it's fake. I think there's a real sickness. I just don't understand why.
COVID-19 is a real thing. It's not nearly as bad as people say. I don't know what Busy was talking about these numbers. Everything I see, even the ones on like mainstream media, if you just look into the article, they're just covering more people. They're saying like there's 10 times as many deaths, but it's because they're looking at 10 times as many people. I mean, that's what's happening.
Yeah. Well, right.
John, didn't you say you saw that they were actually delaying reporting of deaths so that they could keep it up?
Yeah, this is by Ron Paul. Let me find this real quick.
Oh, let me make you host.
Sure.
Oh, here, John, by the way, when you're a host, you can let people share screen by clicking that security button and just hitting allow participants to share screen.
Nice, okay.
Okay,
I'm looking for it, but shoot, I must have lost it. But yes, what they're doing is they were before when like I guess in April and March, a lot of these cases that they're like saying on the news about people dying, they're also talking about the ones that people died months ago, and to make it seem as if there are a lot more people dying. That's what they were doing. They said, they claim that it was just delayed reporting. They just said, we're just delaying the report, but why are you delaying the report?
Why would they do that?
Yeah, why would they do that? Just to keep the level of deaths up over time?
To me, it seems they're trying to sensationalize it even more now. Before, a few months ago, they weren't talking about every single death, right? Because they didn't need to, but now that it was clear that it wasn't as bad as everyone thought, then they're talking about the ones that happened even months ago, and they call it delayed reporting to sensationalize it more. That's my take on it. Is they're just wanting it to hype it up. They just said it's called delayed reporting. That's what they're doing, but they didn't do it before.
Okay, yeah, that's just. Maybe we should end off with what can we do about this?
just look up the facts. I think is just good. It's something like I don't want to take the time to learn. I really don't care. You know what I mean?
Yeah.
But you
That's
kind
the
of.
problem too. How do you look up the facts? Something that is not.
Yeah.
There's so many different people saying different things.
Yeah, you're getting so many sources. How do you possibly know which source to trust?
I mean, I trust InfoWars personally. I trust them over MSM.
You have to know how to read what they're saying.
And you have to know how to read, yeah. You just have to really look into what they're saying. So, like, because...
Well, like, I trust my dog. I don't even have it. I trust a dog over MSN. I trust anything more than mainstream media at this point. And that's not good. I think
like,
we need to get into that next time.
Mm-hmm.
Why there has been blatant lies through mainstream media. There has been a controlled effort to, to have mainstream media tell us mistruths, and why is that?
I think they're very ideologically driven, but I think they literally get told by like executives higher up on what to say, and I hear stories that they get funding from China. I don't know if that is. I don't know why I
have heard that as well. But that there is conflict there, because I see things that are very anti-China all the time.
On CNN.
Yeah, I've heard China owns Hollywood.
Yeah, I think China actually does fund a lot of Hollywood movies. They have such a large audience that Hollywood has to tailor their movies to Chinese people, or what the Chinese government will allow.
They have significant pull. But I think, like, from this conversation, we basically concluded that a ton of places are lying about this and they're overhyping it. That's been proven. Like, all these hospitals in Florida are. Also, there's this negligence on taking care of this. Like, these 5 Democratic governors basically mandating that these nursing homes take in COVID patients. And apparently, according to that one stat by Scalise, the one politician, 40% of the deaths from nursing homes within the past few months were directly from those 5 states. So it's like,
to be fair, what else are you going to do with a person who needs to be in a nursing home who is sick? To be fair, devil's advocate, I mean, what are you going to do with them?
Well, I think the issue was a lot of these nursing homes were saying we cannot put COVID patients, it's like basically people with the flu. They're like, we cannot put these people with the flu in here because there's old people who get sick.
That makes sense.
And the governors were like, you have to take them, even though they couldn't do it. So I don't know the answer. Like, you can't put them on the street. I don't know. But why would you put them with people who can get really sick?
But what they should have done is say, like, extra funding to facilities that do. I don't even know.
Can hospitals clear basically everything so patients could stay in them? More patients could fit in them?
Say what?
Didn't hospitals make much more space available for COVID-19 specifically?
That wasn't even like by choice. Hospitals, my understanding, talking to people like a friend whose wife is on the board at Cleveland Clinic, hospitals have been losing money hand over fist because nobody's going in or anything really. They were at half capacity for months, and there were a lot of layoffs and stuff at UH right now.
So Ada, what I was if you look at the Project Veritas video, there was like literally empty hospitals around the country. It's because the government effed up and mandated that. Okay, this is what Maddie told me, because her mom's a nurse, that they were afraid that because the initial readings of COVID-19 were that it was going to spread like crazy, and it was just everyone was going to get affected. So they didn't want too many people in these hospitals. So instead of just letting the individual hospital dictate how many people they would feel comfortable letting in, the government decided to step in and basically blanket statement everything, or even the governors did too. Instead of just letting the hospitals do it themselves, because they're on the ground, they would have a much better look. And so it turned out that there was like a ton of like basically empty hospitals, or half empty hospitals, that a lot of people could have probably gotten the help they needed. They were literally not allowed to go in there. It's just stupid. The whole thing is.
Yeah.
That's why when Busy was saying she would let the government basically have full control, she has way too much trust in a small group of people. You have to let it grassroots. You have to let the people who are in the scene kind of dictate the shots, right? They would know best.
I think unless it is an actual pandemic that kills a large number of people, you know, and I think in this scenario it's very different than what it could have been. In this scenario, I think, yeah, it would have been best to let individuals choose what to do. I don't know though, but like she said, you know, nobody knew at first.
Yes,
that opened the door to so many other questions. Why were you being given this information that led you to believe this? My question now is, why are there still people who are like you're being lumped into a category of being an anti-masker conspiracy theorist if you question why do we need to wear masks when there's not a single study that has shown that it's beneficial in any way? Why are there people who are so for it?
They're like nuts because they're. It's like what Busy was saying with this, like, what do you call it? Social engineering. You're just like tricking. Like these people really believe everything MSM says, and so they honestly think that if you're not going to wear a mask, that you're like an evil psychopath.
Yeah.
I think part of it is because you're able to feel like you're being very moral because you're doing what's right by telling people they should wear masks. Yeah, you have a moral high ground. Virtue signaling.
Yeah.
The mask thing really does not make sense. If you're worried about it, put on a mask. Why would you force people to wear it? All you're doing is just taking away their rights.
But like before I really looked into it, and I still haven't looked into it thoroughly at all, but before I was like, all right, you know, if this prevents a shutdown, everybody should wear masks because it's gotta be a reason for the mandate. It's gotta do something to slow the spread of it. It doesn't though. That's what I don't get. It's like one thing for me to think I don't know, the kids in the neighborhood and stuff, immune systems being lowered because of a made up thing. But I still think that it should be something like if you are sick or you're concerned about this, you have some sort of disorder where you're like, okay, if I get this, I will be very sick and I'll die. And you stay home. I shouldn't stay home. And in fact, I would want to be introduced to this because I would want to be able to develop an immunity. An immunity to it.
That's right.
That's what a vaccine is. Why? I mean, nobody's been like this about any flu. There was SARS, there was swine flu.
Weren't they saying you could get it more than once? That was the biggest thing I heard.
And that's been conflicting. Like I looked into that, and I did ask my friend, the clinic guy, and he said, you know, there's differing views on all of that. Some people say one thing, some people say another. It depends on where your sources are, who your sources are, and that's the problem. And that was probably a month and a half ago. So I don't know if it's still the same.
Optically, the only people I've known who even sick is one guy who's over 65. It's so clearly not an issue. This is a non-issue.
Yeah, it does not warrant the reaction. But that's another thing about it being man-made. Because I don't believe this came from a bat. I do think that this was some sort of man-made thing, but what's with all the hype about a man-made thing that doesn't do anything?
Dude, next time we discuss this, we should look up actual evidence about this, because I hear things about Bill Gates, and I hear just so many different things.
A lot of people were saying China lost the trade war. A lot of
right.
They had to make a lot of trade war concessions against Trump, and so they did this to hurt the U.S. I mean, and they're back up and running high, so they definitely came out very well.
My thinking of this is either they did this, they made a terrible disease against Trump, or they just made up a story. Do you think it's just a story?
No, it's definitely a real thing.
It's a real, right?
It's
not that bad.
Right.
So who's spending years in a lab making a virus that doesn't do anything? That's what I don't get, and that's what I can't tie together.
Yeah,
maybe it's harder to make a potent virus than it seems. I don't know.
I don't believe that.
Man,
I don't know. But I just think I feel like the generally accepted stories are just conflict each other. It's this was made in a lab, it could have been biological warfare, who knows? But then it's also not nearly as bad as the media makes it seem. Which one is it? Unless it is just that like China is making it like this because of the media, but
maybe it got let out by accident, didn't it? From the lab, at least. You know, so like it was just one of something they were testing.
But again, it's not that bad. So
so they wouldn't necessarily, if they're still doing like testing and it gets let out by accident, it's not necessarily gonna be bad. Just because it's human made doesn't mean it's terrible.
What it seems to me that happened, because I literally was following this since November because there's a YouTuber named Sticks Texanhammer 666 that like I listened to a lot. He was following this.
I would never listen to that guy.
I actually like him a lot. But anyway, he was doing this since November, and what it seems, and this is like his consensus, and I agree based on what I've seen. I'm not an expert, but that they had some virus in Wuhan and somehow it escaped. Something happened where it got out, and it was infecting a lot of people over there. It's just as bad as the flu. And China was basically pretending it wasn't that bad, and they didn't close down. It was basically like letting another type of the flu out. And China did not close any airports down or do anything, any preventive measures from it spreading. And
You heard that in November?
Yeah, this started in November. And Six Hexenhammer, or November/December. And Six Hexenhammer was saying that they did this on purpose because they did this to basically the rest of the world on purpose because they knew this was going to hurt their economy, so they wanted everybody else to suffer too. He just said that was pretty clear that was happening. I don't know about that, but what it seems to me is, regardless, it's their fault. Because whether or not they thought it was as bad as it turned out to be, like with the flu, the fact is they didn't tell anybody it was this bad until way too late. And everybody should be pissed. This is basically an act of war because they are responsible for getting a lot of people killed, because it's like United Nations law, or United Nations power, but it's like world law that if you think that there's some big virus in your country, you have to let people know. And I get that you don't want to, do a bunch of false claims like, oh, this could be bad, oh, it's not that bad. Right. But they gambled wrong. It turned out to be bad.
No, dude, they were hiding it because, well, at least partly because they don't want to hurt their own economy with foreign trade.
Right. Yeah. That's
why?
Exactly.
Foreign trade, and like they don't want to hurt their economy. They care a lot about their public image. So if it seems like they're really getting harmed, you don't want to make it look like that. I
remember reading when this first came out. I was on Reddit. Obviously, I go on Reddit a lot, and people were discussing it. And somebody came on, and they were like, they had posted a comment or whatever, or they started a thread, and they said they started a new thread, and they were like, look, after my last thread, somebody messaged me directly to my inbox, and it was in Chinese, and they had to translate it. So like, here's like the Google Translate of it, and it was a person saying that they were from China and that this it had been engineered to affect people who are Asian more because of some enzymes in their lungs.
I did hear that. Yeah, said that.
And then I read it in another article that it seemed to affect people of Asian descent more. But like, I haven't heard anything since then. That was at the beginning of all of this.
Me neither. And apparently, doesn't the virus strain change as it passes through people? So
because it has one, what do they call it? Like, if it had one cell chain or something, like if something has two cell chains, it won't mutate as much. I'm probably using the completely wrong terminology, but they could create a vaccine for something that has two cell chains or whatever they call it. But they said one, which means it can mutate a bunch. So even if they did come out with a vaccine for it, I don't think it would be effective. It would be like the flu, but maybe even less effective than that.
For
With the flu, they can at least predict which strains will be there that year.
Yeah, and what I fear is that this is just going to happen every year. This is going to be a thing where you're forced to wear masks. Now you're not going to have to.
You have no idea, like, you don't have kids. Imagine trying to figure out school next year. It's terrible. So I got an email from their school saying that we're going to be getting something in the mail tomorrow asking if we want them to be schooled from home or like to be sent into the school. I don't know. And I just don't know what to do anymore. I don't know.
I would bring
And,
them
like,
into
there's
school. They should have some social, although at least your
I
neighborhood is
agree.
great. Because you have a bunch of
I
kids.
know. But there's a school around here that has road. Stop. There is a school around here that they're like, oh, well, to solve the coronavirus problem, we are just going to have school go until 1 p.m. No lunch. Like, we go until 1 and you go back. How does that help anybody who has a job?
Well, how does that help anybody in general? Well, how does that
Well,
stop the
because
coronavirus?
they said, that's what I said. And they're like, well, because they wanted lunch or recess together. So they just have the shitty, but like, come on. And then, like, what does that do to help parents at all? Like, the reason people want their kids to go, like, I don't care if my kids go back to school, other than socialization, fine, I can handle it here. I don't think they will do as well because I'm a terrible teacher, but, you know, I can handle it. But I think a lot of parents want their kids to go back because they have to work. They can't have their kids home all day. But if they get out at 1, what does that help?
What do you
I don't
think?
even know, like, I just don't know what to do. I have no idea. And if this happens every year, man, and I pay for their school. I feel like most people don't anymore.
Well, at least it's a Catholic school, but like, do they teach this like gender, like trans stuff?
No.
They
So
better.
when B was in karate, there were a lot of kids from the local public schools, like in that area. They're like, yeah, they're not allowed to say like his or her bathroom. They're not allowed to use pronouns. And I was like, fuck that. That's ridiculous. That's just ridiculous. That's ridiculous.
That is so stupid. That's just sick. It's like antimatter.
It's ridiculous. I don't know where the push behind that is either.
And I saw it when he was watching TV at Mom Pop's last time I was home. There was a commercial on like Pride Month being played on a kids channel. Pride Month.
Pride Month.
Pride Month.
No, really.
Yeah.
I haven't had that conversation. There was one. What movie was it? It was a kids movie. It had been marketing for kids for a while, and he watched it, and there was like a boy who kissed another boy, and he was like, "What just happened?" I didn't see the scene, but I was like, God, I really hope they aren't pushing that. I don't know. I just don't know how to explain it. Like, it's something like if he one day was like, "Oh, I feel this way," like, fine, whatever. If it's a natural, like, you know, journey of his own, but if it's something where it's like, you know, they feel that way because they get these ideas put into their heads from an outside source, it's okay.
That's exactly what happens, though. Like, my one friend, his daughters are trans, and it was 100%. He even said himself, it's 100% just because of just like pressure, peer pressure, basically.
Yeah, I think it's really bad in girls. Like, there's so many girls I know who like are around 12 to 16, who like people who I know as like siblings or cousins or something who are now like, you're lesbian, you're female. You don't know this. You just don't know. I'm sorry.
I think it's something that they're